The most missed exercise in pelvic floor dysfunction is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. When it comes to pelvic floor, there are so many exercises you see on YouTube, and yet there are so many that you should be seeing that you're not. One of those exercises is what I'm about to show you, and it has to do with your hip mobility. See, if pelvic floor is the inside lining pelvic floor muscles, the inside lining of your pelvis, your thigh bones are connected to this bowl, and that's where your hip socket is. So the integrity of that joint plays a role in the alignment and integrity of the pelvic inlet and the muscles of the pelvic floor that basically lay within this pelvic girdle. Hip mobility is a huge factor in the positioning of your pelvic girdle and the integrity of your pelvic floor muscles. One of my go-to exercises has to do with sitting in a neutral position, which I'm going to show you in this position. So you're sitting on your seat bone upright, and your thighs are as wide, or your knees are as wide apart as your hips. Your feet are flat on the ground. So in that position, you're not upright sitting because you're pushing your chest forward. Is you're upright sitting as if someone is pulling a string that goes all the way down to the space between your external genitalia, penis or vagina, and your anus. So if there's a spot there and a spot in the middle of your head, and there's a string attached all the way there, if I were to pull it, what would that look like? About this. So now I'm going to turn around and show you that's the positioning, and then you're going to go into a 90-degree hip and knee, I should say, knee flexion, and then you're going to be carrying this. So this is a rectangle that the top and bottom need to move together. So you're not going to be rotating to initiate the movement. That's wrong. What you're going to be doing is moving all of this together, down to that. Together, down. Together, parallel to each other. This provides a movement opportunity within this ball and socket hip rotation, which frees some of the tension, and that tension is one of the reasons why this bowl is not being carried effortlessly like it should. Huge problem that we're seeing with all postural issues, including pelvic floor dysfunction, and one of the things you should definitely give attention to. If you have any questions, make sure you use one of the methods of contact in the description box, and make sure you subscribe to the channel. Until next time, take care.